Last year, national TV and radio presenter Bill Turnbull turned the spotlight on prostate cancer when he announced he had been diagnosed with it. If you need any evidence for the good raising awareness can do, private healthcare provider Bupa saw a jump in bookings for its male health assessment the very next day. With Turnbull's documentary Staying Alive, following his search for a treatment, airing on Channel 4 last night, it's likely many people will be looking to get more information about prostate cancer, and they may well come across some of the common myths surrounding the disease. Myths help nobody when it comes to medical problems, so we asked Professor Hashim Ahmed, consultant urologist at Bupa Cromwell Hospital, and Dr. Luke Powells, associate clinical director for Bupa Health Clinics, to set the record straight. Point 1. If you don't have symptoms, it means you don't have prostate cancer. This is absolutely not true, says Ahmed. In fact, when prostate cancer is in the early stages, it's unlikely there will be any symptoms at all. Symptoms are likely to start when the cancer has spread to the bone. At this point, pain can be felt in the hips, back, or pelvis, which may be confused with another problem such as arthritis. If you notice any symptoms, don't panic but see your GP as soon as possible. 2. Being able to pee against a wall from a long distance means I don't have prostate cancer. This is certainly not a tried and tested method of diagnosis, says Ahmed. Essentially, having a strong flow of urine when going to toilet is normal. Say if this changes and the flow of urine decreases over time, then it is something to get checked with your GP. While we're on the subject of toilet behavior, an increased need to urinate, going to the toilet more often, or getting up in the middle of the night for a wee can be signs of prostate cancer. If you are concerned about any of these symptoms, it's important to go and visit your GP. 3. Having a vasectomy can cause prostate cancer. It was once believed that having a vasectomy increased a man's risk of prostate cancer, says Ahmed. However, more recent research has proven that there is no definitive link between the two. A vasectomy requires your prostate to be checked, so by having the procedure, prostate cancer might be detected earlier by a urologist. 4. Prostate cancer only affects men over 70. It's a common misconception that only men over 70 can be diagnosed with prostate cancer, says Powells, but it's something that younger men need to be aware of. While typically it's diagnosed mostly in men aged 65 and older, there are cases of men being diagnosed in their 20s and 30s, although the disease is rare under the age of 50. What's more, the condition is more likely to be aggressive in younger men, so it's important that men of all ages are keeping an eye out for the symptoms. 5. An injury to your genitals increases your chance of prostate cancer. While blunt trauma to the scrotum can certainly be painful, there is no research to prove the injury itself can increase risk of any form of cancer, prostate or otherwise, says Powells. Point 6. Sitting with a laptop on your lap can increase chances of prostate cancer. There's speculation that Wi-Fi can increase the risk of prostate cancer. However, there is no evidence to suggest radio waves emitted from a laptop can cause prostate